I will be discussing the negative effects of nicotine, a highly addictive substance that not only poses high health risks, but also has a high-reaching impact on both society and individuals as a whole. Leading more into the effects of nicotine, the most common being heart health, mental health, addiction, lung problems, as well as birth defects. Starting with heart health, nicotine poses very high risks. It increases blood pressure and heart rate, extra strain on the blood vessels and heart, over time leading to a risk of heart attacks and strokes. Mental health is another huge factor. It can lead to an increased anxiety and depression as the brain becomes dependent on the substance. Over time, the dependency can cause mood swings and irritability when nicotine levels drop, all contributing to a cycle of addiction and emotional instability. Addiction being the most frequently associated factor causes your brain chemicals to change, reinforcing the behavior, leading to repeated use. Over time, our brain becomes dependent to release dopamine, making it difficult to quit. Lung problems also being a huge risk causes irritation to the airways and can cause inflammation that can lead to chronic conditions such as bronchitis and COPD. The damage reduces the lungs' ability to effectively exchange oxygen and carbon dioxide. Long-term use can cause lung cancer, making it a huge threat to lung health. Lastly, birth defects. Nicotine used during pregnancy restricts blood flow and oxygen to the baby, which can affect development. Babies exposed to nicotine in the womb are at higher risk for low birth weight, premature birth, and disabilities such as cleft palate or heart defects. But where did nicotine come from, and when did it become an issue? The recorded history of tobacco is considered to have started in 1492 between Christopher Columbus and the indigenous people, when the Arawak people presented dried tobacco leaves from then on only to become more popular. In 1930, nicotine became a huge advertisement, promoting the use of nicotine to be beneficial, companies even going as far as using physicians in order to stop the concerns of nicotine from rising. The so-called doctors in these advertisements were just actors, and they were just used to gain the trust of consumers. It was to make them believe it lowers stress and can help with health issues to raise the sales. Since then, the rise of nicotine in cigarettes continued, with the dramatic increase during the 1800s in America. In 2020 was the first time annual cigarette sales increased in 20 years, but luckily has been dropping more in numbers since. Some other terms for nicotine being firstly naturally produced alkaloid, which is an organic compound that contains nitrogen and is naturally produced found in tobacco. Tobacco is most commonly associated with nicotine, is a plant and a term for products made from the leaves. Finally, the term anxiolytic is a drug type of nicotine, meaning it reduces anxiety levels and used to regulate mood. Now we're going to move forward with the positive effects nicotine has on us. Nicotine has shown some positive effects on our cognitive functions. It can enhance attention span, improve our memory, and it can increase alertness. Some studies show how it might help with conditions such as Alzheimer's and Parkinson's disease by boosting certain neurotransmitters to our brain. It can also positively affect our mood by acting on our brain's rewarding system. Nicotine stimulates a release of dopamine, which can cause a feeling of relaxation and can temporarily reduce feelings of stress or anxiety. Weight loss is another factor of nicotine, which causes appetite loss and increases our metabolism, which leads to a decrease in food intake, causing weight loss. Finally, nicotine, specifically patches, help with tissue repair. The nicotine stimulates the release of certain growth factors and can improve blood flow, which may affect the healing process to go faster. It's shown to promote repair of the skin and bone tissue by accelerating collagen production. So how can we improve our society and lower the risk of addiction? Firstly, the huge impact of our health nicotine has should hopefully be enough to steer enough people away from the drug. It needs to be talked about more to bring more attention to the serious harm it has. Secondly, we can help reduce the addiction potential by providing more help for people addicted and bring awareness to those individuals. Finally, using a phased implementation to gradually wean off nicotine, or even using nicotine replacements to help get rid of the addiction. In conclusion, nicotine is a nasty addiction and way too easy to be dependent on. As a community, we need to spread awareness on nicotine as well as help people who are suffering with addiction. Just being supportive would make a big impact, or even looking into therapy or group therapy to help anyone struggling. While nicotine may have some temporary positive effects on things such as cognitive function and mood, its negative impacts far outweigh these benefits. We also need to be stricter about the regulations on nicotine, even raising the tax price or advertising it more in school to help prevent the use of nicotine and the horrible effects it will have on us. The detrimental impact on overall health and well-being underscores the importance of seeking healthier, safer alternatives for stress management and cognitive enhancement, Prioritizing methods that do not carry such severe risks is essential for maintaining long-term health and quality of life.